So I'd like to introduce our speaker, Mary McGreary. Mary is the director of the State Health Insurance Assistance Program, known as SHIP, in the New Jersey Department of Human Services, Division of Aging Services. She has worked with SHIP since 2005, where she has been involved in health insurance, counseling for aged and disabled Medicare populations. She also provides education and training on Medicare for professionals working in social services, legal, insurance, and healthcare fields. As director of the program, she oversees funding and training for over 400 counselors statewide. Mary is a graduate of Rutgers State University with a master's degree in social work. She earned her BSW from Mary Wood University in Scranton, Pennsylvania. So welcome, Mary.
Thank you very much, Maggie, and good afternoon, everyone. Thank you for joining us on this beautiful day to talk about Medicare. So we are going to be talking about what to look at during Medicare's open enrollment period and what some new things about Medicare for 2022. And I'm going to be focusing on those changes. So I'm not talking about people newly enrolled in Medicare. So I will not be talking about who's eligible for Medicare and how to enroll when you retire. This seminar is focused on people already on Medicare and need to know what's going to be new for next year, and particularly what's new in the Part D drug plans and the Medicare Advantage plans. So I work for the Division of Aging Services, and we're going to start with talking about COVID. Medicare does cover many, many things that are COVID-19 related. And let's start with the COVID vaccines and now the big buzzword are the COVID boosters. So Medicare is covering all of the approved COVID vaccines and all of the approved COVID boosters, and they cover it at 100%. So you should not have to pay anything when you go to get your COVID vaccine or your COVID booster. They cover both the cost of the medication itself and the doctor's or nurse's fee for administering the vaccine. So no cost to you. Vaccines are available, readily available now at all pharmacies, all clinics, doctor's offices, regardless of where you get the vaccine. You should be covered at 100% for it. What you do want to bring with you when you go to get your vaccine, your red, white, and blue Medicare card, because that provider will bill Medicare for the cost of the vaccine and their services. Even if you're in a Medicare Advantage plan, those are the Medicare HMOs and PPO plans, you still want to bring your original Medicare red, white, and blue card because Medicare will pay for the vaccine rather than the Medicare Advantage plan. Lots of questions about the boosters. Medicare is covering now all of the FDA approved boosters, and there are now all 3 manufacturers have been FDA approved. And just this week, the FDA has said that you can get whatever booster that you want or that's available at the site. It does not have to be the same manufacturer for the booster that you got from your original vaccine. So if you have any concerns, talk to your doctor about that, but the FDA has approved mixing of the vaccines and the boosters in terms of the different manufacturers. Also, if you want to be tested for COVID, Medicare will cover that also. It's covered under your Medicare Part B as in boy, just like you would any other type of clinical lab test. There is no cost sharing for the COVID testing, so you shouldn't have to pay towards your Part B deductible or your 20% coinsurance. And that should apply again, whether you have original Medicare or if you have a Medicare Advantage plan. COVID testing should be covered at 100%. Medicare does cover the first COVID test without a need for a doctor's prescription, but in order to cut down on waste, Medicare is asking that you do have a doctor's prescription for any subsequent COVID testing so that people are not overly getting tested if it's not really medically necessary. If you do come down with COVID, Medicare will cover all approved COVID treatments, but the cost sharing does apply. So if you do have to be admitted to the hospital to be treated for COVID, Medicare will cover that treatment, but the normal Part A hospital and Part B medical deductibles and cost sharing will apply. If you're in a Medicare Advantage plan, those plans, some of them are waiving cost sharing for COVID treatment, but it's not a requirement. So check with your plan to see if you are being treated for COVID, what the copays will apply. Lastly, on the topic of COVID, Be very aware of scams. There is a large uptick of the number of scams we are seeing related to COVID in terms of having to pay to get on a waiting list to get a vaccine or a booster, or people offering to send you a COVID vaccine at home or COVID testing at home for a fee. Please be very, very wary of that. That again, you should not have to pay anything to get a vaccine or a booster or a COVID test. Please know, however, Medicare is not covering the over-the-counter COVID testing that are available now at the local pharmacy that you buy at the pharmacy and bring home to administer yourself. Those are not covered by Medicare. Medicare will only cover your COVID test if you go to a testing site or a doctor's office or a pharmacy to be tested for COVID. So moving on to what's new, the first news is the cost of living adjustment for Social Security benefits. So if you are collecting your retirement benefits or in Medicare due to disability, in case you missed it, there will be a 5.9% increase in your cash benefits starting in January. This is the highest increase since 1982. So the average retiree will see about a $92 a month increase in your benefit. And if you're on Medicare due to disability, the average increase will be about $76. So you can figure out how much it is by looking at the gross amount of Social Security benefit you're getting and adding 5.9% to that. So just some basics before I go into other parts of Medicare and cost sharing. Medicare has 4 distinct parts. They're labeled by letters A, B, C, and D. Part A of Medicare is the inpatient hospital insurance, and Part B of Medicare is the medical insurance. Part B is what most things are built towards. So doctor visits, medical testing, medical equipment, that all goes through the Part B of Medicare. Those 2 parts of Medicare, A and B, are referred to as original Medicare or traditional Medicare. The other 2 parts of Medicare, C and D, are optional. Part C is referred to as Medicare Advantage. That's where you're getting your Part A and Part B benefits rather than through original Medicare. You're getting it from an insurance company that has contracted with Medicare to offer those benefits in the form of managed care. That would be an HMO or a PPO. And that's an option for you to get your hospital and medical either from original Medicare or from a Medicare Advantage plan. The last part of Medicare Part D is the Medicare prescription drug component. C and D of Medicare are not administered directly by the federal government. Instead, for both C and D, Medicare contracts with insurance company to offer you those benefits. And those are common insurance company names like Horizon, Blue Cross Blue Shield, Aetna, United Healthcare, etc. Well, you do need to understand, though, that each of these 4 parts of Medicare have their own rules associated with them. So each of them have rules for who can enroll and when you can enroll. Each of these parts have their own distinct monthly premium. There's not just one premium for Medicare. There could be 4 distinct premiums for each of these parts, A, B, C, and D. Each of these parts of Medicare has its own deductible. That's the amount of money you would have to pay before that part of Medicare would pay. And each of them have different cost sharing in the forms of co-insurance or co-pays. So in understanding Medicare, you need to understand what the rules and the costs are for each of those parts, A, B, C, and D. Now, in the Part B of Medicare, and then that's the most frequently used part, that's the medical insurance, that does have a monthly premium. But Medicare has not yet announced what the monthly premiums will be for 2022. This year, most people are paying $148.50 a month, but we don't know what that's going up to for next year. Part B also has an annual deductible, which also has not been announced, but the premium and the deductible for next year will be announced at the same time. We anticipate that that'll come out in early to mid-November. Right now, the Part B deductible is $203. Part B also has a co-insurance that's 20% for most Part B services. So when you go to the doctor for an office visit, or get a procedure from the doctor, Medicare pays 80% of the approved rate for that service, and the doctor can bill you 20% of the Medicare rate for that service. So that 20% does not change. That's fixed each year. Then there's something called an excess charge. If you see a Medicare doctor, so this is not a doctor who doesn't accept Medicare, but a doctor that does accept Medicare, some of them do not accept Medicare assignment. That means that those doctors can charge you not only the 20% coinsurance, but also an additional 15% on top of that. So those are doctors that do not accept Medicare assignment is the word. If you have additional insurance besides original Medicare, like having a Medicare supplement policy, also called a Medigap, or maybe you have retiree health benefits from your former employer, those policies usually cover some or all of the deductible, the coinsurance, and the excess charge. Most of them do not cover the Part B premium, but most of them of the supplemental type of policies will cover these additional Part B costs. Now, the Part B premium is also based on your modified adjusted gross income. So you see here from this chart, if you're a single individual and your modified adjusted gross income is over $88,000, you are in the higher tier and you will pay a higher Part B premium. Again, we don't know what those amounts are. You could see on here the 2021 amounts, and we'll shortly know what the 2022 monthly premiums will be. Those individuals that have to pay a higher Part B premium, that is referred to as an IRMA. I-R-M-A stands for Income-Related Monthly Adjustment Amount. Okay, so this is added on to your Part B premium that you would pay every month to Social Security. Okay, I just want to remind you for questions, we do have a chat box, so feel free to chat in a question at any time. And I will be stopping at certain points to allow you to unmute your phone line if you want to ask a question over the phone. Right, but for now, please use the chat box if anything, you have a question or comment on any of the materials I'm presenting. So we are currently in Medicare's annual enrollment period, and that started October 15th and will go through December 7th. This is not the time that people enroll in Medicare A or B when you're new to Medicare. Instead, this is the time for people already on Medicare to switch their Medicare prescription drug plan or to switch a Medicare Advantage plan. So during this window of time, if you currently have a Medicare drug plan, you want to compare it to the other drug plans going to be offered for next year and switch to one that's going to best suit your needs. Also, if you're in original Medicare right now, you can switch and instead get your benefits through a Medicare Advantage plan. If you're already in a Medicare Advantage plan, you can switch to a different one or go back to original Medicare. So that's what this period of time is for. And whatever choices you make during this window, the change will take effect on January 1st. Please note that this period of time does not refer to changing your Medicare supplement policy. There is no annual enrollment for Medicare supplements. You can apply for or switch your Medigap policy at any time during the year. Okay, so let's talk about the changes in the Medicare Part D drug plans. In New Jersey, we will have 23 drug plans available for 2022. We currently have 30, and that's because certain plans are merging. WellCare, which normally right now is offering 6 Part D drug plans, they are merging them down to 3. Most of the people will automatically, if you have a WellCare Part D plan now, you automatically might be moved over to a different WellCare plan with a premium that's similar or even a little bit lower than you're paying now. There is one exception to that. Any member currently enrolled in the WellCare Medicare RX Select plan, and you're currently paying $28.50 a month for that plan, the new plan you're going to be moved to is called the WellCare Value Plus plan, and that plan has a monthly premium of $69 a month. So you definitely want to do a comparison to see if there is a lower premium plan that'll meet your prescription needs. Excuse me. Sorry about that. Let's try again. There is another company that is not renewing. That's the Unicare Medicare RX Basic. If you're enrolled in that plan, you should have gotten a letter telling you that that plan is not renewing its contract. So much for a cough drop, it made me choke instead. All right, so if you are that Unicare plan, you do have to take action to enroll in something else. If you take no action come January 1st, you will not have any drug coverage. So make sure you read your mail carefully and choose another plan for January. The other thing that's changing are the Part D Express Script plans. There were 3 of them. Those plans have been bought out by Cigna Insurance Company, and all members have been notified that they're changing over to now a drug plan with Cigna. Most of those Express Script members, when they move to a Cigna plan, will also be paying close to the premium they're paying now, with one exception. If you currently have the Express Scripts Saver plan and you're paying $27.70 a month, when you're moved to the new Cigna Extra plan, your premium is going up to $64.80. So again, another big premium increase. You really should do a plan comparison to find a plan that might be a lower premium to cover your prescription needs. These are our 3 plans out of our 23 that have the lowest monthly premium. One is called Express Scripts Smart RX, whose monthly premium is $7 a month. Then we have the WellCare Value Script at $12.90. And then lastly, we have the Clear Spring Health Premier Plan, $18.70 a month. The costs in our Part D plan for next year, and the costs do change every year in terms of what Medicare is allowing. The premium range is a lowest cost from $7 all the way up to $100 a month. So there's a wide range in the premiums that those 23 plans charge. The average premium is about $37 a month. A Part D plan can have a deductible. Many of them don't, but if they do have a deductible, the most deductible they can charge is $480. Then there's something called the initial coverage period. After the deductible is met, then you pay a copay or a coinsurance for your drug at the pharmacy counter, and your Part D plan pays the rest. You stay in that initial coverage period until the total amount of drugs you have received reaches $4,430. So that's what you pay at the pharmacy counter and what your Part D plan has paid towards the cost of your drugs. Those 2 things together, if it hits that amount, you'll then fall into the next benefit phase called the coverage gap. People call the donut hole. While you're in the coverage gap, you'll pay 25% of the cost of your drug, whether it's a generic or a brand name drug. And she'll pay the same 25%, regardless of if it's generic or a brand name. You'll stay in the coverage gap until your out-of-pocket cost for the year reaches $7,050. So that out-of-pocket cost would include the $480 deductible that you paid, all of the copays you paid during your initial coverage period, the 25% of the cost of the drug you paid during the coverage gap, and it also includes a discount you're getting on brand name drugs while you're in the coverage gap. And that's 70% of any brand name drugs that you take. That 70%, which is paid for by the drug manufacturer, counts towards your $7,050. So you're not, all of that would be coming out of your pocket. Some of that would be coming out of the drug manufacturer. If you do go out of your coverage gap, you then fall into the catastrophic benefit. While you're here, you pay a small copay for brand name and generic drugs, and you'll pay that copay for the rest of that calendar year. This is just another graphic to help you explain how the costs change over the benefit of your Part D plan. So during your deductible, you'll pay up to $480. Initial coverage period, you pay approximately 25%. It does change from plan to plan, and then the plan pays the rest. In the coverage gap, again, 25% you pay for generics and 25% for brand names. And in the catastrophic benefit, you'll pay up to 5%. So just a graphic to show you who pays what during each of those phases of the Part D plan. So other things to note about the Part D plans, many of the plans that do have a deductible do not charge the deductible for some lower tier drugs. So all of the plan, drugs that they cover, they place them into cost tiers, tier 1, tier 2, tier 3. And many of the plans that have a deductible do not charge it for tier 1 or tier 2 drugs. So that means that you get help paying for those drugs right away. You don't have to pay that $480 first. Then we have a couple of plans that have some extra coverage in the coverage gap, meaning that if you reach the coverage gap for some drugs, not all of the drugs, but for some drugs, the plan will help you pay for them in the coverage gap, so you'll pay less than 25% of the cost of those drugs. And again, these are our 3 low-cost plan. I'm going to check on that WellCare value script, 1290. Also, we have 7 of those 23 plans participate in what's called an insulin savings program, where for certain insulins in that Part D plan, you'll pay $35 or less for a 30-day supply of insulin, and you'll pay that through the deductible phase, the initial coverage period, and the coverage gap. So it gives you a more level amount of what you would pay if you are taking an insulin. Okay, so I have some clarification here. The $12.90 plan is called Value Script. The other plan that has the $69 a month premium is Value Plus. Okay, so WellCare has 2 different plans. One is the Value Script plan, that's $12.90. Then they have another plan called the Value Plus, that's the $69 plan. This is a chart of the Part D plans offered in New Jersey, and we have this available on our New Jersey SHIP website. So at the end, I'll give you the reference to our website and how you can get a copy of this chart. So this chart lists all of the 23 plans and the insurance companies that offer it. So you can see here we start with the AARP plans, which are offered by United Healthcare. And on the chart, we show you the premium. So the full premium for this first plan here as an example is $29.30. If you do get help for paying for your prescriptions from either Medicaid or the federal program called the Low Income Subsidy, LIS, they will help you pay that premium so that you would only have to pay $6.30. And I'll talk a little bit at the end of the presentation about how to be eligible for those programs. Our chart also shows you the deductible in each of the plan, and if that plan does not charge the deductible for some tiers. So you see here on the AARP Medicare RX Walgreens plan, they have a $310 deductible, but there is no deductible for tier 1 and tier 2 drugs. So they'll help you pay for those tier 1 and tier 2 drugs right away. We also show you on the chart those 3 or 4 plans that have some extra coverage in the coverage gap. So you see here the WellCare Extra plan does have additional gap coverage, and that means for some of the drugs, again, not all of them, but some of them you'll pay less than 25% of the cost of the drug in the coverage gap. Our chart also shows you which plans work with our PAD program, Pharmacy Assistance to the Aged and the Disabled, and I'll also tell you about eligibility that towards the end. So if you have help paying for your prescriptions from PAD, what plans you can join where you'll have a 0 premium. Our chart also talks about preferred pharmacies. So all of our Part D plan, all except one, they have a network of pharmacies that you can use the plan in. But within that network, if you go to certain pharmacies with trade code preferred, you'll pay even less copay. So for an example here, the Cigna Essentials plan, if you go to Rite Aid, Walgreens, or Walmart, you'll pay a lower copay than if you went to, say, your local pharmacy or a CVS as an example. So CVS is not a preferred pharmacy for that plan. So these preferred pharmacies that we're on our chart, we just list the chains. There might be other pharmacies that are preferred, like local independent pharmacies or a grocery store pharmacy, like at a ShopRite or some other local pharmacy. So we just highlight on here the chains, but you can call the plan or check with your local pharmacy to see which plans work with what pharmacies you like to use as a preferred pharmacy. Lastly, our chart also highlights those plans that participate in the insulin savings, and we do that with a blue circle. So on our chart, you get a lot of information about the different plans. So when you are looking at the Part D plans, the things that you want to look at to find the best plan for you, the first thing is the coverage. Does the plan cover all of the prescriptions I'm currently taking on its formulary? Also, do they cover them without any restrictions? Some of the plan can cover a drug, but they could have something like prior authorization, where they'll say, we're only going to cover this drug if you meet our criteria for it. So the doctor is going to have to give some medical notes as to why you need that particular drug. Another restriction is called step therapy, where the plan will say, we'll cover that drug only after you first try an alternative to see if that works, and then we'll step up to the original one if the alternative doesn't work. So these differ from plan to plan. So you want to find a plan that covers your drug without these restrictions on it if you can. After the coverage component, then you're looking at the costs. You want to look up not just the premium, so just say, well, I'm going to go with that $7 plan. You only want to do that if you don't take any prescriptions. So if you don't take any prescriptions, but you want to have this drug insurance to have as a backup, then go with the lowest cost premium plan. But if you are taking prescriptions, the figure you want to look at is called the total yearly drug plus premium cost. So you want to look at a plan that's going to be the cheapest, not only for premium, but also for the copays for the drugs that you're going to have in that plan. And on the Medicare website, I'll show you, you'll be able to see that number on the website. Next component is the convenience. I talked about these network of pharmacies the plans have, and they have these preferred pharmacies. So you want to find a plan that offers the pharmacy you like to use as a preferred pharmacy. Lastly is coordination. If you get help from any of our government assistance programs, you want to enroll in a Part D plan that can help you with the costs in that plan. Or for example, if you have some additional drug coverage from, say, your union that helps you with some drug costs, you want to see if that will work with the Part D plan as well. So Medicare has an excellent website they call the Medicare Plan Finder. It's open to the public. You don't need a special password to go in, and it's at medicare.gov. On this Plan Finder, you can type in the list of your prescriptions, and it'll tell you of our 23 Part D plans, which plan will cover your prescriptions at the lowest cost. So this is the home page for the Medicare Plan Finder, and there's two ways to log in. The first one is by creating a Medicare account. So if you have already created a Medicare account, it used to be called My Medicare. They've changed it to just a plain old Medicare account. If you have an account, you would log into your account here, update your prescription drug list if it needs any changes, then you'll be able to sort through the formularies of the plans. If you don't have a Medicare account and don't want to create one, you would just click the link underneath it where it says continue without logging in. You would go into there, type in the prescriptions that you take, and it'll then list all of the plans and the costs in all of the plans based on the prescriptions that you take. This is a sample page from the Medicare Plan Finder after I have put in all my prescriptions. You would click on the link that says Plan Details for the top plan that comes up. And you want to look at what's called the estimated total drug plus premium cost. So this is to be in that plan for a whole year based on the prescriptions that I entered and based at the CVS pharmacy. because you're going to put in a pharmacy as well. And notice it's telling me that for this plan I'm looking at, CVS is a preferred in-network pharmacy. So I'm getting my best prices for this plan at the CVS pharmacy. And for the drugs that I had put in, my total yearly drug plus premium cost is $1,508. So that's the figure you want to look at in comparing the plans. You're not just going to look at premiums, not just going to look at deductible. This is the figure that's comparing apples to apples. The plan finder will also tell you if that plan has a deductible, approximately what month that deductible will be met based on the drugs that you entered. And it will also tell you if you'll reach the plan's coverage gap, about what month that will happen, and if you'll get out of the gap. So you'll see here it says, I will not get out of the gap because of the drug. I do not take that many expensive drugs. So all that information is there based on the prescriptions you enter. If you do want to create a Medicare account, it is a secure account, so you will have to establish a username and a password to get in it. You would just go to medicare.gov and click create an account. Once you do this, you'll be able to see all of your Medicare claims throughout the year. If you have original Medicare, your hospital and medical claims, you'll be able to view them. It will also already show your prescriptions from your Part D plans. You don't have to enter them in every year. And there's a very good video on YouTube that will walk you through how to create this account if you're a little bit unsure about using the internet. Now, what if you did your homework and you enrolled in a Part D plan that covers all of your prescriptions, but now you get a new prescription in the middle of the year, and you find out that the Part D plan you have doesn't cover the drug. You are locked into your Part D plans until the next open enrollment. So in that, if you get a new prescription your plan doesn't cover, one of the options you have is to switch to something similar that the plan does cover. So say your doctor writes you an antibiotic for an infection that you have and the Part D plan doesn't cover it, you can then call the Part D plan to find out what similar antibiotics for that is covered and ask the doctors to switch your prescription. If the doctor says no, that's the best drug for you for this condition, then your doctor can work with your Part D plan to get what's called an exception. So the doctor can say that my patient can't take that drug on your formulary. They need this particular one, and this is the medical reason why they need it. So the plan will entertain exceptions to cover a drug for you in that case. If the plan denies that exception, you can appeal it, and there are 5 levels of appeal. I always encourage people to at least do the first level of appeal. This case, your doctor can provide some additional medical evidence, and it will go to an entity outside of your Part D plan to review it, to make a decision if that Part D plan should cover that drug for you. Or now this is the opportunity that we're in the annual enrollment period. If you are taking a prescription that your Part D plan does not cover, now is the time to find out if there is another plan that will cover it and save you some money by doing that. Okay, so I've talked about original Medicare Part A and Part B, and I've talked about adding on a Part D prescription drug plan to that. Now I want to talk about the other option you have. Rather than getting your Medicare coverage through original Medicare A and B and adding on a Part D drug plan, you can combine all of these benefits into one plan called a Medicare Advantage plan. Now you have this choice when you're brand new to Medicare, decide how you get your benefits. And now in the open enrollment period, you could also make a decision about how you want your benefits, either through Medicare Advantage or through original Medicare. So let's talk about these. They're referred to as Medicare Part C, but mostly they're referred to as Medicare Advantage. Here you're combining hospital, medical, and prescription benefits into one plan, and you're getting benefits from a private insurance company that Medicare contracts with. When you enroll in a Medicare Advantage plan, you're going to get all of your benefits through that plan. You're not going to use your Medicare card for some things and your Medicare Advantage card for other things, with the exception of that COVID vaccine I mentioned before. But because these are managed care plans, now you cannot go to just any Medicare doctor. Now you need to follow the network of doctors and hospitals and labs that that plan has contracted with. And in some plans, you might need a referral from your primary doctor in order to see a specialist. The advantage part of Medicare Advantage are many of these plans offer extra benefits that original Medicare doesn't have. Things like eyeglasses, hearing aids, dental services, and gym memberships. And these greatly vary from plan to plan. You want to make sure that you get the details about these extra benefits if you're considering enrolling in one of these plans. The plans offered does differ from county to county. So if you live in Mercer County, you'll have available different plans to enroll in than if you live in Hunterdon County. The plans all have a wide range of premium, but we do have more than half of our Medicare Advantage plans have a zero premium. Some plans have a premium as much of $135 a month. In addition, we even have some zero premium plans that will help you pay towards your Part B premium, that $148 a month I talked about earlier. If there's a Medicare Advantage plan, though, whose premium is more than $100 a month, those plans are really not the best value, and you really should be looking towards Medicare Advantage plans whose monthly premium is less than $100 a month. Some plans also have not only a drug deductible, but they might have a medical deductible that you have to pay so much the full cost for an office visit or a hospital stay or an MRI before the plan will pay for those services. Even if you have a plan that's a zero premium Medicare Advantage plan, you will have a copay every time you use a service. So every time you see a primary doctor, you'll have a copay. Every time you see a specialist, you'll have a higher copay. Every time you get a lab test or go into the hospital, you'll have a cost share for those services. So in Medicare Advantage, you pay for services as you use them. These plans, though, do have a maximum out-of-pocket. So if you hit a certain dollar amount during the year, then the plan will cover you at 100%. And these maximum out-of-pockets is a range from $6,700 up to $7,500 for the year. So the max out-of-pocket is quite high, but it does have that if you do have a year where you're in and out of the hospital a lot, getting a lot of physical therapy, having a lot of doctor's visits. So that max out-of-pocket is there to protect you. These supplemental benefits or extra benefits that the Medicare Advantage plans offer include things like dental benefits, but most of the dental benefits have a dollar cap. And the highest one I've seen is around $2,000 in dental services for the year. Many of the plans are also offering home delivered meals for about 2 weeks if you have a hospital stay. Many of the plans are also offering what they're calling an over-the-counter spending card, where you'll get a debit card that you can use to shop for health-related items at a local pharmacy or local store, or to order things from a catalog. So things like Tylenol or adult diapers or cold medicine or vitamins. Some of the plans are offering transportation to medical appointments. And many of the plans are offering what they're called worldwide emergency coverage, where if you're traveling outside the United States and need to go to the emergency room, the plan will cover you for that. Many of our national plans, like the Aetna United Healthcare plans, have a travel benefit that if you're a snowbird, you can still get routine care from their plan providers outside of New Jersey. On the Medicare Plan Finder, the same one that you would use to look at those prescription drugs that I showed before, you can also look at Medicare Advantage plans on that Medicare.gov website. This is an example here of the Aetna Medicare Prime Credit PPO plan. And you'll see here it tells you it's a zero premium. There's no, but it has $1,000 medical deductible. It tells you what their maximum out-of-pocket is on the left-hand side. Then over on the right-hand side, it tells you about those extra benefits, what it has. It has vision and dental and hearing, but it doesn't have transportation as an example. If you're using the Plan Finder and you put in your prescription, it'll also tell you then what your out-of-pocket cost is for your health costs for the year. So you'd want to click on the Plan Benefits tab to get out more information about all the copays that the plan has, and in particular, more details about those extra benefits. Okay, so if you clicked on the plan details, this is what you would see. And these are the information about those extra benefits, what's covered and what's not covered. But as an example here, you see eyeglasses has a 0 copay with some limits apply. So it really doesn't give you that dollar amount that what the plan would pay towards eyeglasses. You want to go to the plan's summary of benefits. You're going to go to the plan's website and look for something called summary of benefits, and it'll give you those details about those things, the actual dollar amount you're going to get for those extra benefits. Another reminder with if you have end-stage renal disease, you can enroll in any Medicare Advantage plan, but all of the plans have a 20% co-insurance for dialysis. So it could be quite expensive, but you would be protected by that maximum out of pocket. Once you hit that amount, then they'll cover you in full for dialysis for the rest of that year. We do have some plans that are not renewing in New Jersey, and someone already chatted that in about the Horizon Blue Cross Blue Shield. So Horizon Blue Cross Blue Shield offers Medicare Advantage plans in many counties, and they're not renewing certain plans in certain counties. So this here you see the various plans that there are not renewing. You should have gotten a letter from Horizon if you're in one of these plans in one of the counties where they're not renewing, and you will have an extra time to choose something else. Also, there's a plan called the WellCare Focus HMO plan that is also ending in certain counties only. We have about 5,200 people that these Horizon terminations is affecting. And if you're in one of these plans, the plan will end on December 31st, and you must take action to get coverage for next year. If you take no action come January 1st, you will have no drug coverage. You'll return to original Medicare Part A and Part B and will have no supplemental health coverage. You do get extra time to choose something else. You have until the end of February to either pick up a Part D plan to use with your original Medicare or to choose another Medicare Advantage plan. If you don't want Medicare Advantage, if now you want to stay with original Medicare and a Part D plan for your prescriptions, you do have what's called guaranteed issue to purchase a Medigap policy. So again, if you're in a Horizon Medicare Advantage plan that is terminating in your county, you can get a Medicare supplement policy and they cannot turn you down for medical reasons. And you have this guarantee issue until March 3rd. Okay, so here in New Jersey, our rules for getting Medigaps is quite limited. You can only get a Medigap without any medical questions asked when you're brand new to your Part B. But if you've had Part B more than 6 months, then they could turn you down. They can't turn you down, though, if your Medicare Advantage plan is terminating. So it's a good opportunity to get a Medigap if you were not able to get one before. If you are considering Medicare Advantage, please note that you should carefully study not only the benefits and the copays in the plan, but also the network, particularly the hospital network. Not all Medicare Advantage plans contract with all of the hospitals, including Capital Health. They only work with some of the Medicare Advantage companies, not all of them. Also look at the drug coverage. Make sure they have the drugs you take on the formulary and have a good price for those drugs that you take. If you are changing your Part D plan or Medicare Advantage plan, you can do it a number of ways. You can do it on the Medicare's website, or you can call 1-800-MEDICARE to do it, or you can call the new plan. You don't have to disenroll from your current plan. So simply by calling or enrolling in the new plan, that will terminate your existing plan you're in now. So that's for Part D plans going from one Part D to another Part D, or from Medicare Advantage, okay? So you don't have to disenroll from the old plan if you have Part D or Medicare Advantage and you're enrolling in something different. If you do decide to try Medicare Advantage for next year, or if you're in one now and you're going to stay in it, you do have an extra 3 months to change your mind. So Medicare has what's called the Medicare Advantage open enrollment period from January 1 to March 31st. And you can switch to a different Medicare Advantage plan during that time, or you can leave it and go back to original Medicare with a Part D drug plan. Do know, though, that if you're leaving a Medicare Advantage plan during that window, you might not be able to get a Medigap policy, because if it's not a guarantee issue situation for you, that Medigap company could turn you down. So you want to apply for Medigap first before leaving that Medicare Advantage. There are 2 situations where you can try Medicare Advantage risk-free, and that's our first check here. If you currently have a Medicare supplement policy and you want to try Medicare Advantage for the first time, you can do it and you get a 1-year trial-free risk-free trial. So anytime during 2022, you can disenroll from that Medicare Advantage plan, return to original Medicare, get a Part D, and you can get the Medigap policy back that you had before. Okay, so if you have a Medigap policy now, you want to try Medicare Advantage for the first time, you have a 12-month trial to leave it at any time and get that Medigap back. The other trial is if you're turning age 65 and go right into Medicare Advantage, you also get a similar 1-year trial in that situation. Okay, so I've talked about original Medicare, I talked about Medicare Advantage. Now I want to talk about Medicare supplement policies. So if you have original Medicare and you want a Medigap policy, now Medigap policies do not work with Medicare Advantage. Okay? You only get a Medigap policy if you're going to stay with original Medicare. These are also sold by insurance companies like the United Healthcares, the Aetnas, the Cignas, etc. And they cover the cost sharing in original Medicare. So they cover that hospital deductible and the 20% Part B coinsurance. All of these policies are standardized, and the different Medigap policies are labeled by letter A through N. So standardized means that if you get a Plan N from Horizon, it'll have the same benefits as a Plan N from Aetna, Cigna, or any other carrier. What is going to differ is the premium that the plan's going to charge you for it. So the benefits are exactly the same, but the premium will differ from company to company. When you have original Medicare and a Medigap policy, there are no networks to follow, no prior authorization, no referrals. You can go to any Medicare provider or hospital in the United States that accepts Medicare. Okay, so it's not just in New Jersey, you can use it anywhere, and there are no networks or prior authorization or referrals. Medigap policies do have a monthly premium that you would have to pay in addition to your Part B premium. And the premiums for Medigaps vary widely depending on how old you are. So at age 65, the Medigap premiums will be about $100 to $135 a month. If you're closer to age 80, your monthly premium will be closer to $300 a month. So the policies are based on age, and as you age, your premiums for the Medigaps will go up. Medigap policies are secondary insurance, so the doctor is going to send the claim to Medicare first. Medicare will pay the doctor the Medicare rate. Then Medicare sends the claim automatically onto your Medigap policy to then pay the balance. Okay, so it's secondary insurance. As I mentioned earlier, the best time to buy a Medigap is when you are new to your Part B and you have a 6-month window. The first 6 months of your Medicare Part B, you can apply for a Medigap and not be turned down because of medical reasons. If you wait longer than that to get a Medigap, they could turn you down based on medical conditions. Medigaps do not cover prescriptions, so you would have to get a separate Part D drug plan. And again, the premiums will increase by age. Medigaps travel with you, so if you move from New Jersey to Florida or anywhere else, you can keep the Medigap that you purchased here. We refer to this as our star chart, and this is also posted on our website. It shows the difference between the different Medigap policies and what they cover. We highlight here the Medigap D because if you're under age 65 on Medicare due to disability, that's the only Medigap that is sold to you here in New Jersey. But you see here the Medigap Plan G, as in girl, has the most number of stars in it. And if you, so that's the most comprehensive Medigap you can get, as opposed to a Medigap Plan N. The Medigap Plan N has a copay for doctor's visits, whereas the Plan G does not have a copay. The Medigap G picks up the entire 20%. So that's how you would read this chart, and this is posted on our website. Also, more Medigap information can be found on the Medicare website. They have a very good book called Choosing a Medigap Policy. And on our New Jersey website, we have a chart of the Medigap plans, companies selling Medigaps here in New Jersey, and a chart of the rates at age 65. You'll also find on our website. The decision to take original Medicare and a Medigap policy or go with the Medicare Advantage plan is an important decision to make. If you have health coverage from your former employer or union, they usually only work with original Medicare. So you don't have a Medicare Advantage option in that case if you have retiree health coverage. If you are a snowbird and spend long periods of time outside New Jersey, even though those Medicare Advantage plans have a travel benefit, it might be more flexible if you went with a Medicare supplement policy. And if you want the freedom to go to any Medicare doctor or hospital, then the Medigap policy would be preferred over a Medicare Advantage plan that has provider networks. This is an example I do about how costs vary, whether you have a Medigap policy or a Medicare Advantage. So this first example is for Mrs. Healthy. And if Mrs. Healthy enrolled in a Medicare Advantage plan, she'd still have to pay her Part B premium to Medicare every month. And I estimated here for next year, $150 a month. But she enrolled in a Medicare Advantage plan with a zero premium. She doesn't have to pay the Part B deductible because her Medicare Advantage plans covers that. And her plan to see a primary doctor has a $20 copay. And since she's healthy, she goes to see the primary doctor twice a year. She does have a specialist she also sees twice a year. Her plan had a $50 copay for that. She had a bunion removed and outpatient surgery, and her plan had a $125 cost for outpatient surgery. And then she does use diabetic supplies, and her plan has a 20% cost share for that. Her plan covers her for dental, so she had no cost to get her routine cleaning and checkup. And her cost helped her, her Medicare Advantage also has an eyeglass benefit, and she only had to pay $100 for a pair of eyeglasses. So at the end of the year, if Mrs. Healthy's in a Medicare Advantage plan, her total cost would be $2,418. Now, if Mrs. Healthy instead stayed with the original Medicare and had a Medigap Plan G, she still pays her Part B premium from her Social Security, and her Medigap would be about $135 a month. She does have to pay her Part B deductible because Medigap G does not cover that. But then every time she went to the doctor or had surgery, her Medigap picked up the full cost for that. Medigaps do not cover dental, so she had to pay the full cost for her dental visits. And Medigaps do not cover eyeglasses, so she had to pay the full $500 cost for her eyeglasses. So the end of the year in a Medigap, she paid almost double what she would have paid in a Medicare Advantage. Now let's look at her husband, Mr. Sick. Now, Mr. Sick, if he had a Medicare Advantage plan, the same one his wife did, he had many doctor visits. He had quite a few hospital stays. He had an inpatient rehab stay. And these are all the copays in his Medicare Advantage plan for the various services he used. So by the end of the year in Medicare Advantage for Mr. Sick, he paid over $8,000 towards the cost of his health care. If Mr. Sick instead had original Medicare and a Medigap G, all of those medical services would have been covered by his Medigap, and his out-of-pocket for the year would be just over $4,000. So for people who are healthy, Medicare Advantage plans make more sense, and people that are not so healthy, Medigaps make more sense. The problem is we don't have the crystal ball to know what our year ahead is going to be on what our medical costs are going to be, correct? And when you're healthy on Medicare Advantage, you can't switch anytime over to the Medigap because you're locked into Medicare Advantage for the year, number one. And number two, you may not be able to get a Medigap once you're sick. So it is a difficult decision to make. And last thing I'm going to talk about is the different programs we have for people who are limited income. The first one is Medicaid, and here in New Jersey, we call that New Jersey Family Care. So if you're very limited income, if you're single, if your monthly amount from Social Security and pensions is less than just about $1,000 a month, and you have no significant assets or savings, you can get help from New Jersey Family Care. They'll pay all of your Medicare premiums and Medicare cost sharing, and you'll just have a small cost sharing for prescriptions. You apply for New Jersey Medicaid at your County Board of Social Services. If your income's a little bit higher than that, if your monthly amount from Social Security and pensions is not more than $1,449 if you're single, and your money in the bank or assets is less than $7,900, you could qualify for help to pay your Part B premium. That program is called SLMB, for Specified Low Income Medicare Beneficiary. You can apply for that at this toll-free number on the slide or at aging.newjersey.gov. Lastly, I have some very important news about our New Jersey pharmacy assistance programs. These two programs have been around many years, but starting in January, our legislature has increased the eligibility for these two programs by $10,000. The first one is called PAD, or Pharmacy Assistance to the Aged and Disabled. And you see if you are single and earn less, have less than $38,796 a year, or married couples less than $45,270, you can get help with your prescription costs. This PAD program will pay the premium for your Part D plan. You'll have no Part D deductibles or donut hole. Instead, you pay $5 or less for any generic drug you take, or $7 or less for any brand name drug you take. So this is an excellent program, and many more people will be eligible for it starting next year. Our other prescription program is called the Senior Gold Prescription Discount. And again, you see here the very high income eligibility for this program, and there is no asset limit for these programs. The Senior Gold program, you pay a $15 copay for a prescription or less, and then Senior Gold pays half of the remaining cost for that. Also, yes, the PAD program also is only based on income. There is no asset requirement for the PAD program either. They do count any interest that you earn off of assets, but they do not count, there is no max on the capital amount of any assets you have. Okay. Both of those programs, the PAD, the Senior Gold, and the Help with Part B premium, that's the SNB program, it's one application called NJ Save, and you can apply for that at any time. Just lastly, a word about if you're currently getting coverage under an Affordable Care Act insurance policy, also called a marketplace policy. Those are insurance policies for people who are not yet eligible for Medicare and don't have insurance through their employer plan and don't qualify for Medicaid. That's another way to get health insurance. And here in New Jersey, our marketplace is called Get Covered New Jersey. So you can get health insurance under Get Covered New Jersey if you're not yet eligible for Medicare and don't qualify for Medicaid. If you currently have a marketplace health insurance plan and you're turning now 65, it's not advisable to keep that policy, because if you're getting subsidies to help you afford that, those subsidies will go away once you turn 65, and then they're no longer affordable. So you want to drop that coverage with the marketplace plan and instead get your Medicare Part A and Part B and consider getting either a supplement or a Medicare Advantage plan. Okay, so again, your Medicare choices are original Medicare, Part A and Part B, adding a Medicare supplement policy onto that, or if we have retiree coverage, that'll supplement your Medicare A and B. And you might need a Part D prescription plan if you're not getting prescription coverage from your former employer. An option to that is a Medicare Advantage plan where you get all of that hospital, medical, and drug coverage together in one plan. Open enrollment ends December 7th, so you have until then to make your choice. If you are in Medicare Advantage, you get another 3 months of the year until the end of March to change Medicare Advantage plans if you're not happy with it. Also want to remind you about scams. Medicare or Social Security will not call you out of the blue at home. Those are scammers. And never give out your Medicare number, your bank account number to anyone calling you unsolicited. The charts for all these New Jersey Part D plans, Medicare Advantage plans, are on the aging.nj.gov website. We also have a toll-free number that you can call with Medicare questions. Also, we can help you with one-on-one with assistance. So in addition to the Medicare website and calling the plan or calling 1-800-MEDICARE, you can call our SHIP program. And if you're a Pennsylvania resident, Pennsylvania also has a Medicare navigating program. They call it Pennsylvania Medicare Education and Decision Insight, and they have a toll-free number and a website as well. Okay, so I'm just going to take a look. I believe I addressed all of the questions that have been chatted in so far. If you would like to ask a question over the phone, I believe you might be able to click on your phone to unmute yourself or chat in another question about anything that I've covered so far. So I'm opening it up now to questions, either over the phone or via chat, if I didn't cover anything or you need clarification or something I did discuss. So the copy of the slides I did share with Capitol Health, and I believe they're going to email them out to everyone who registered for today's presentation.
This is Maggie. I did put the website that they can go to get to see the recording of the your presentation, and I will put the email of the person who they can contact if they want to get copies of the slides. I'll put that in the chat box. Okay, great. Yeah, I see you did chat in the survey link, but I didn't. Did folks get an email about the recording? Yeah, I put that in there too, where they could get a copy of the recording. So I'll do that again, okay. And then I'll put the person's name that they can contact at Capitol to see if they can get the slides. Great, thank you. Okay, is there anyone would like to unmute their phone? And if you can't unmute it, chat in to me that you'd like your phone unmuted. I could unmute you from this end. Okay, while we're waiting on anyone to chat in, I do just want to let you know that our SHIP program is available to assist you one-on-one. We can help you over the phone. So most of our programs are just doing phone assistance because of still COVID restrictions, but some sites are open for face-to-face appointments. So you can call your local SHIP to get an appointment by phone or face-to-face if you'd like.
Hello, this is Renee. I have a question.
Yes.
I have a grown daughter with a disability, and she's on Medicare. She's been on quite a while, and but she doesn't have the drug coverage, and I'm just unsure of what to do because she has MS, and you know she takes a lot of, well, not a lot of drugs because she can't afford these.
Oh, and you live in New Jersey?
Yes.
Okay, and do you live in Mercer County?
Mercer County, yes.
Okay, all right, so call, I'm going to go back one slide. Okay, Renee, so you can call our SHIP office here, the 1-800 number. Okay. And right, and we'll put you in, we're going to screen you to see if your daughter is eligible for prescription help from our PAD or our Senior Gold program first. And if she's eligible for those programs, they'll enroll her in a Part B plan. And if she's not eligible for PAD or Senior Gold, then we'll set you up with a local counselor. She'll get a list of your daughter's prescriptions and suggest the best Part D plan for her.
Great. Thank you so much.
Okay, you're welcome. Okay. Anyone else want to unmute their phone or type in a question? Okay, Maggie, it looks like that's it for today. So I want to thank you all so much for joining me. I hope that you found today's presentation helpful. I'd encourage you to please click on that Survey Monkey link to do an evaluation to see if today was what you expected and if you found this seminar helpful.